are joined by Lebogang Moatshe, a qualified embryologist and founder of the IVF Connect and global ambassador for the World Infertility project, with both local and international recognition, including the International People of Change Award. Yay.
Big deals.
Listen, for her work in STEM, she is becoming a powerful voice in the fight for infertility and awareness.
Lebogang not only brings her hands-on experience in IVF labs, but also her deep passion for patient education and emotional support. We definitely need that education today. Now, through honest conversations, one-on-one consultations, and advocacy, she's helping South Africans understand their fertility options and reminding them that they don't have to face the journey alone. Skim Saka, please help me welcome Lebogang Moatshe. Woohoo! Hi, Lebo.
Yes.
I love the po. Hi, Lebo. How are you?
Hello. Thank you so much for having me.
It's a pleasure, ma'am. We need to have you today for this conversation, which has not had a lot, openly.
Yeah.
Let's get straight into it. I think before we even get into the crux of the conversation, what is IVF? Tools asked me and I was like, actually, what really is it? We speak about these things every day, but we don't really know what it entails. So quickly just break it down to us, please, Lebo.
Okay, IVF gets a little 12.
True.
IVF stands for in vitro fertilization, and it basically just means that we mimic conception that happens in vivo meaning inside the womb. We mimic that inside the lab. So it basically caters to couples that are not able to conceive naturally after a year or two of attempting sexual intercourse, and they're not able to be successful. So IVF caters to those patients, and what we do is that we basically inject sperm into an egg, and it grows, develops into an embryo. We then take that embryo and then we implant it inside the woman's uterus. They wait for 2 weeks and we wait for that miracle.
Oh, wow. So it's a 2-week waiting period.
AI, mama.
Yeah.
It's giving AI.
AI, baby.
Okay, and what is generally the success rate? Just so we know.
It really depends on age, and I mean the success rates that you mentioned are, they're correct. That for women that are less than 35, you get your 60 to 70% success rate, and for women that are 40 and above, it's much less.
So the younger the better. Tools, you must start today.
The sooner the better.
Today.
What are some of the most common causes for infertility that you see in both males and females? Because we understand that it's an issue that affects both males and females, but what actually causes it?
So the most common causes that I've seen or dealt with are delayed childbearing, your poor sperm quality for men, and conditions like PCOS or fibroids for women. But they're not always purely medical, actually. Your stress, poor nutrition, and untreated STIs, and even working conditions can impact your fertility. For example, I had a patient, I spoke to a patient virtually who works night shifts, and she drives a truck with no time or access to health education, and her fertility concerns had never been explained until our session. So information gaps and systematic barriers also play a big role in terms of causes of infertility.
Okay, and can you talk about how male infertility is often overlooked, like it's a ladies' thing only?
So for male infertility, it's basically based off of a serious challenge of accessing infertility treatment. So basically what happens is that it's based on, cultural and stigmas that are, overlooked. And about 1 in 3 infertility causes are actually due to male factors, like your sperm count, your low sperm count, motility. But because there's a silence around men's reproductive health, testing is often delayed. So it's actually very critical that both partners are assessed early. So men should actually, do semen analysis and not be presented or discouraged by the stigma and egos and pride that society presents them with.
Now, as we have mentioned right in the beginning as well, you said IVF ke tjhelete, which is true, right? And
Yeah.
it is life-changing, but it's also very, very costly. What are some of these financial, obstacles that couples often experience? And also, have you actually ever had anyone say, we are stopping here, we can't afford anymore?
Definitely, absolutely. I think you mentioned that Tuli said that, per cycle means per attempt, which is basically that the first time that you try IVF, it doesn't mean that it's going to succeed. So the typical cost of IVF in South Africa, as you mentioned, is between 60,000, 100,000, and even more, depending on whether you need your embryos frozen or you need genetical testings that need to be done. And as you mentioned, that most medical aids don't cover it. And for many couples, that's completely out of reach, and public sector options don't often exist. And they're very limited, actually, and often come with long waiting lists. Like your Steve Biko and your Grooteskier hospitals, they actually do offer IVF, but they are accustomed to a long waiting list. As well as, the cost of travel, time off work, and medication add to the burden. So a lot of patients that I've dealt with had to be left to fundraising, take out loans, or postpone treatment, and sometimes until it's too late.
Where is Steve Biko based? I know Grooteskier is a Cape Town hospital. So that's one in Cape Town, Mother City, and then the other one is where?
In Pretoria Central.
Imagine. So throughout South Africa, it's either you're in Cape Town or Pretoria to get this from government.
Yep.
And this list, do you know how many people are on there? Do we have a number? Because you said it's a long waiting list.
Yeah, we don't really have a number, and if there are stats, they're not publicly published. So I can't honestly give you a number. I'm just assessing based on what patients tell us regarding how long the waiting period is.
Now, you founded the IVF Connect. What role does this play in the community and, of course, emotional support for people going through this journey?
It plays a critical role. At the IVF Connect, I basically offer affordable consultations, and they're virtual consultations. So I do consultations whether on Zoom, WhatsApp calls, phone calls, because a lot of people cannot afford to travel. I often speak to patients that are even in other countries that need information. And my consultations range from 280 for an hour, 200 Rand for 30 minutes, because it's mostly about answering questions and patients wanting to understand their results and feel supported. And some questions that, patients would want to ask would cost them about 2,800 Rand just to ask questions based on IVF. So that's basically my focal point, so that, my platform fills that gap. And it's not just about information, it's about being heard and not feeling alone.
What advice do you give, to young couples or just individuals really who are struggling but are still hopeful about becoming parents?
The most important thing is start by getting informed. Knowledge empowers you to ask the right questions and make better decisions. And don't wait too long to get checked, and don't carry the burden alone. Lean on support systems, whether that's a partner, a friend, or a service like the IVF Connect. And most importantly, your journey is your own. Whether it takes time, detours, or a different path entirely, it's still valid. And even those ones that are over the age of 40, we've had successful pregnancies through donor oocytes, donor sperm, and even their natural eggs. So they also have a chance at conception.
Okay. But now, we use the word advocacy a lot, and of course there are always these hashtags. I don't see a lot of them for infertility though. So, what does advocacy for infertility awareness look like in South Africa, and how can we, better support those affected? Also, let us know where we can get in touch with you if we want to have conversations with you.
Advocacy for me personally means breaking the silence and normalizing these conversations that we're currently having about infertility in homes, clinics, workplace, and the media. And it also is pushing for better healthcare policies and access to treatment, and also pushing the public health sector to treat infertility like the condition it is, and not just a private shame, if I can put it like that. So there are actually groups like We Are Women Too that is founded by Mapulando, and what it does is that they do vital work to give the voice to overlooked stories. And as a society, we must listen, support, and treat infertility as a public health priority, and as I mentioned, not a private shame. And as for me, you can definitely find me on TikTok and Instagram at Lebogang Moatshe on all social media platforms.
Thank you so
Shout
much,
out.
Lebza.
Boop, 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 boop.
I thought I'd call you Lebza because
I
you
love
called
the
me
energy.
Truly. So I'm calling you Lebza. It's only right.
It's fair.
It's only fair.
Nickname for
Yeah.
nickname.
Nickname for nickname, Lebza Ngwanane. Thank you so much for chatting with us. I hope you have yourself a beautiful night. Huh?
Thank you so much. Enjoy the rest of your evening.
Thank you.
Lebza.
Bye.
Hey, now we know.
Now we know for when we do try. I don't know when that's going to be. My God, now I know I need to start before 35. Thank God.
Yeah.